Cardiomyopathy is a disease of the heart muscle causing structural and functional abnormalities, excluding coronary artery disease, primary valvular disease, and severe hypertension. It is classified into dilated, hypertrophic, and restrictive phenotypes, or etiologic groups including genetic, primary, and secondary causes. Dilated cardiomyopathy shows left ventricular dilation, with reduced ejection fraction, typically less than 30 to 40%. Hypertrophic cardiomyopathy shows thickened ventricular walls with preserved or increased ejection fraction and risk of sudden cardiac death. Restrictive cardiomyopathy is characterized by diastolic dysfunction, with preserved systolic function and massive atrial enlargement. Genetic cardiomyopathies involve sarcomere, cytoskeletal, desmosomal, and nuclear membrane protein mutations. Familial transmission is often autosomal dominant, with variable penetrance and age-dependent expression. Dilated cardiomyopathy can result from ischemic injury, alcohol toxicity, viral myocarditis, autoimmune disease, and peripartum cardiomyopathy. Alcohol is a major reversible cause when intake exceeds 80 to 100 grams per day over 5 to 10 years. Peripartum cardiomyopathy occurs in the last trimester to 6 months postpartum, with risk factors including preeclampsia and multiple gestation. Mechanisms include antiangiogenic signaling, oxidative stress, and prolactin-mediated myocardial injury. Toxic cardiomyopathy includes anthracyclines, trastuzumab, cocaine, and multiple chemotherapeutic and immunologic agents. Endocrine causes include thyroid disease, pheochromocytoma, diabetes, and obesity, leading to either dilated or restrictive phenotypes. Restrictive cardiomyopathy is caused by infiltrative diseases like amyloidosis, sarcoidosis, and hemochromatosis. Patients present with progressive exertional dyspnea, fatigue, orthopnea, edema, and arrhythmias. Advanced disease may lead to cardiogenic shock with hypotension, pulmonary edema, and multi-organ dysfunction. Diagnosis includes ECG, echocardiography, cardiac MRI, genetic testing, and sometimes endomyocardial biopsy. Dilated cardiomyopathy shows ventricular dilation and mitral regurgitation, with high risk of ventricular arrhythmias. Restrictive cardiomyopathy shows preserved ejection fraction, with severe diastolic dysfunction and atrial enlargement. Initial evaluation includes history, toxins exposure, thyroid function, iron studies, and imaging for structural abnormalities. Treatment depends on phenotype and includes neurohormonal blockade, diuretics, device therapy, and advanced heart failure management. Genetic cardiomyopathies involve mutations in sarcomere and cytoskeletal proteins, leading to structural instability and arrhythmias. Amyloidosis shows infiltrative restrictive physiology, with characteristic thickened ventricular walls and conduction disease. Final takeaway is early recognition of